Well, Dr. Irgau, we are going live now.
Okay.
Make sure you're sharing the presentation.
Not yet.
Okay.
All right, we are live. Sorry, we were having some issues, some technical issues from Zoom, but we are live now. My name is Kemal Erkan. I'm the chairman of American Surgery Center and also United Medical ACO.
And I am Dr. Irgau. I am the president of Chrias, the Christiana Institute of Advanced Surgery.
All right, so we have some updates for today's presentation. Dr. Irgau, well, first of all, thank you for your taking time from the office hours for this. We believe that this is extremely important for us and for our patients. So we have some of our existing patients who are following this and some of the new patients who are trying to actually go through this program. So what we wanted to do is, because the whole process can be long in like before and after surgery, we started having these sessions where we are focusing on specific topics. Today we are going to do the life after bariatric surgery. And again, the American Surgery Center is a MBCAQIP accredited organization for bariatric. We have other accreditations for the excellent surgery in excellence. So now we do different things, but today we are going to, of course, focus on the gastric sleeve. Our program started in 2018, as most of you already know, and we are doing most of our gastric sleeve cases at our center. And the process last week, what we discussed was different bariatric surgery types, and Dr. Irgau explained these. Dr. Irgau, if you can just maybe briefly just summarize what we had last week.
Absolutely. So yes, Kemal, as you correctly said, we started doing the surgeries at the surgery center in 2018, but we've been doing bariatric surgery, of course, since 2001 as a group. The surgery types that you have here that we talked about on our last Facebook Live session, Kemal, include the gastric band, the sleeve gastrectomy, the gastric bypass, the video pancreatic diversion, and the switch. And as you correctly said, in this larger slide, we see depicted the sleeve gastrectomy, which is the procedure that we do most commonly. It's a very popular procedure, and the goal really is, as we talked last time, to divide the stomach in such a way that a very small portion of the stomach will be left and the larger portion of the stomach will be removed. So the person ends up having a much smaller stomach that looks like a banana almost. And the weight loss occurs obviously because the person cannot eat a lot and they're not hungry frequently, but more importantly, that surgery also affects their metabolism in a very, very positive way.
So, Dr. Irgau, the way we are processing the bariatric, as you and I, we go through our daily case conferences with our team, making sure that patients are getting the best care prior to the surgery, during the surgery, and after the surgery. Now, because the process is long, in my opinion, it's a pretty long process, and insurances really need to work on this, and they need to make this, it's almost like if we are penalizing the patients in a way, the system, not we are. Yeah. The system is almost penalizing this. So if this is a chronic disease, then patients should be able to get this surgery in a timely manner. Now, again, we are not talking about someone with 27 BMI getting this surgery. We have patients, unfortunately, dropping out with BMI 55, 57, and it's heartbreaking in certain ways because we know that this is the main problem, most of the other disease that patient may have. This is the key that needs to be addressed. It can help their diabetes, their hypertension, and cardiac-related issues. So now, the good part of this, I guess, Dr. if we now start the process and I am then able to get my surgery, so we have our start here and we want to be here. Now, of course, these are just pictures. But before I start this, and we discuss in a couple of our other sessions, why is it so important to have the excellence in bariatric surgery, and why do you think Chrias and Chrias surgeons are better qualified for that?
So absolutely, excellence is obviously very important because bariatric surgery is not something that can be taken lightly. It's a necessary life-saving treatment for a devastating disease that we know as morbid obesity, where the weight have gone really way out of control, but it is really literally killing the patient because of the very serious diseases that come with it, like diabetes, like heart disease, high blood pressure, and sleep apnea, as you mentioned. And really, the process has to be done in such a way that the results are the best they can be. It is, as it is, it's very, very hard for patients to really decide on undergoing surgery. In fact, as you know, only 1% of the eligible patients end up having bariatric surgery. And part of the reason is there is reticence from many patients to really undergo the surgery. And it's up to us, the surgeons, the centers, to demonstrate the highest level of safety. And this can be attained with great deal of experience. Chrias surgeons are well positioned in that sense because simply they have been doing this for the longest period of time. As we talked before, we have done thousands of cases successfully. We have established centers of excellence for bariatric surgery in the main health centers in our area, in the hospitals in our area, and more recently at our surgery center as well. So excellence in bariatric surgery is what patients deserve and what they expect when they are really thinking of undergoing bariatric surgery, as I said, which is not an easy decision to begin with.
Thank you, Dr. Irgau. So now, once we are done, again, what we were discussing is getting to this point. And now we have our surgery, and let's use me as an example. So let's say tomorrow is my surgery day at American Surgery Center. So our wonderful nurses took care of us, our wonderful surgeons performed the surgery. So, and let's say if my BMI is 52. So when am I gonna be okay, and what's gonna change for me for the rest of my life? Now, one maybe opening for you is it true that almost like 60% of the extra weight is being lost from 12 to 18 months period? Is that true for vast majority of the patients?
Absolutely, absolutely. And very often even higher proportion of the weight actually is lost between the first year and a half after surgery. In fact, really most people lose a lot of their weight in the first 6 months. Most patients will see a very rapid weight loss in the first few weeks, first few months after their surgery. You know, it's really the fun time for patients because they are extremely happy that the weight just melts off so quickly after the surgery. Now, after that period of rapid weight loss in the first few weeks, first few months, the weight loss starts to slow down. And there are times in which there are plateaus, which means that the weight doesn't change for a few weeks. And then suddenly patients will see a weight loss as well. So what I do in the office generally is I look at a plot, at a graph that shows me the weight loss over a period of time, right? And I see how steep that graph is. And I show that to patients. I tell them, look, sometimes they're worried because they've lost, for instance, 50, 60 pounds in the first 2 months, and then suddenly they start slowing down. They don't see any weight loss for a week, maybe for 2 weeks. But that is very normal. That's how the weight loss occurs. The body really slows down a little bit, and then the weight loss starts occurring again. So when I look at a graph of the weight loss over a period of time, I see a much steeper curve than the patients actually realize. So to summarize, most of the weight loss definitely occurs in the first 12 to 18 months after surgery, and very often in the first 6 months after the surgery.
And during that time, Dr. Irgau, how often do I need to come to you to see you after the surgery?
So reasonably frequently, actually. In the first year after the surgery, we will see the patients, first of all, 2 weeks after the surgery. Then we will see them at 1 month after the surgery. Then we will see them at 3 months after surgery, and then at 3 months intervals for the first year, and then 6 months intervals in the second year, and then yearly after that. So clearly, these are patients who are going to be patients for life with us under our care. But at the beginning, that intense follow-up is necessary to make sure the patient is adapting well to their eating habits, that they are still focused, that they have started and doing physical activity on a regular fashion, all very important components for long-term success. Remember, the surgery is not a magic answer. It's a tool, a powerful tool, but still a tool. So having a lifestyle that is healthy from eating point of view and also physical activity is critical for long-term success.
So you said eating habits. So if we were to elaborate what it is and how it's different for patients with bariatric surgery, can you kind of elaborate that for us?
Absolutely, absolutely. So let's take, for instance, the sleeve gastrectomy, which is the most common procedure, for instance. First of all, after the sleeve gastrectomy, in the long term, there are no specific foods that you cannot eat because of the surgery. Clearly, it doesn't mean that we're okay with any type of food. We don't really advocate junk food. We don't advocate soda and stuff like that. We want a healthy lifestyle. But in terms of being able to eat and digest food, you're able to eat any type of food. That is the premise about the sleeve gastrectomy. Having said that, because the amount of food that you can eat is very limited from a volume point of view, we want to make sure that a greater proportion of that food is in terms of the nutritional components that you need, for instance, protein, because you need a certain amount of grams of protein a day to stay healthy. We tell you focus on the protein first, right? So protein first, vegetables and fruits next, and then carbs last. That would be the way we would want you to proportionate your foods. Now, clearly, in terms of how you will be able to eat the substantive food is going to be different at the beginning. In fact, for the first 2 weeks, people are going to be on a liquid diet. For the 2 weeks following that, they're going to be on what we call a pureed diet. And then slowly we will advance them to chewable food. So eventually they will be able to eat any type of consistency, but the type of food they eat has to be healthy food. And part of the coaching at the beginning is to prepare them for that.
So, Dr. I'm not going to pretend you and I, we talk every day, but we don't rehearse for this, right?
No.
So maybe 10 minutes before the event, we know what the topic is.
Yeah.
We have our daily case conferences. And as I'm listening, you said the eating habits and the changes that we are talking about. But when we say protein, vegetables, and carbs in that order, is that also not true for people with no bariatric issues or no bariatric surgery?
Absolutely.
Or am I?
Absolutely. No, you're absolutely right. I think that's very, very correct. Protein is very important for us. Now, the reason we focus so much on protein when it comes to bariatric surgery clearly is because there is a mandatory amount of protein each one of us needs to eat every day, right? That is to stay healthy. Now, when we are not bariatric patients, because we are able to eat a lot, clearly whatever type of food we eat, there is going to be enough protein for us to get by, right? But when it comes to bariatric surgery, now there is going to be a lot of struggle of all the components to fit in, right? So we don't want the protein to have same equal amount as the carbs, because we don't need the carbs as critically as the protein. And the total amount of food available is small. So we want people to first have protein. That's why we emphasize on that essentially.
So other than the eating habit changes, because we are discussing the life after bariatric, now there are other diseases that comes with obesity, with morbid obesity. And usually the obesity is the root of the problem in many cases. So how is that going to change for the other disease that the patient may have? Like, are they going to be off their diabetes medication in 6 months or 8 months, or their hypertension is going to be well managed in 3 months? What's that from the like interacting with the other or impacting the other health issues that we may have?
Absolutely. That's where patients get really, really excited very often. They would call me and they would say, my doctor has taken me off my diabetes medication because my sugar was falling too low. My doctor has taken me off my blood pressure medication because my blood pressure was going too low. Well, it wasn't going too low. It's becoming normal. That's what happens. So they don't need those medication anymore. So to be in a situation where you were taking 4, 5, even more medications a day, suddenly you don't need those medications. It's really a sense of freedom that is enjoyed immensely by post-bariatric surgery patients. So yes, bariatric patients would expect to have great improvement in those medical conditions like diabetes, high blood pressure, and very often, but more substantially, sleep apnea. Patients who've been suffering with sleep apnea for a long time and who have to sleep with a CPAP machine, within a few months after their surgery, they are taken off that machine as well. And they tell you that they've slept without the CPAP machine and they've never had this restful sleep for many, many years. So many of the medical conditions clearly are impacted by bariatric surgery just because of the significant amount of weight that gets lost within such a short period of time.
So now, you know, after we lose all this weight, right? So then all of a sudden, you know, let's say patient was 340 pounds, now they are 190 pounds. So that's great. But then the other issue is what's going to happen with the skin access in
Absolutely.
that case. And our team, like how are we helping the patients in that case?
So you could say one of the drawbacks of bariatric surgery is excess skin, because what happens is very often a lot of the fat, the excess fat, is actually accumulated right underneath the skin. And as that fat melts away and it disappears with weight loss, the excess skin persists, because remember, our skin loses its own elasticity in childhood. In childhood, yes, the skin is very elastic, but when we are grown up and adults, the skin elasticity is gone. So when the fat that was stretching the skin disappears, the skin becomes lax. And that skin excess is something that is inevitable when somebody loses 80, 90, 100, 120 pounds. So what happens is that, well, patients can do certain things to try to improve on it by toning their muscles, for instance, but certain areas of the body are not readily amenable for that. So about 15% of our patients actually end up having a surgery to remove excess skin. We do not recommend looking into that at least until 18 months after the surgery, when they will have completed most of their weight loss, but that can occur. Now, we have to look at skin excess, you know, in the way patients look at it. It's a very personal thing. For instance, a little bit of excess skin may not be acceptable to some patients. Other patients, having a lot of excess skin doesn't bother them. One common thing that they could both have, however, is irritation of the skin, difficulty keeping it free from infection, from rashes. That can happen. And in that sense, we can help by providing medications and other treatments to keep that area clean and free from rashes and irritation.
So, you know, in our team, Dr. I do want to mention, other than yourself, we have Dr. Wynn, Dr. Gail Wynn. Now, between two of you, you guys started in 2000. I met you in 2003. So it's been a long journey for us, and I enjoy every minute of it. Now,
So do we.
Are we the first one in Delaware who performed the bariatric?
We're the first ones to have really introduced the modern type of bariatric surgery. There were surgeons who did open gastric bypass before us, but really we were the first ones to introduce laparoscopic approach to weight loss surgery, particularly to really bring substantial experience in terms of the laparoscopic procedure, which means doing a whole surgery with very small incisions. And then clearly after that, our group was the first one to establish centers of excellence in bariatric surgery, not in one, but in many hospitals around our area. And of course, we've trained many surgeons as well who've gone to become bariatric surgeons themselves. So our group has by far the biggest experience in our area. Even the surrounding counties in the surrounding states recognize our group as the most experienced group when it comes to bariatric surgery.
And, you know, we have Dr. Mike Peters join us, who used to be the program director for one of the major hospitals in the in town, and Dr. Singh and Dr. Ibrahim. And Dr. Sajumwait is our colorectal surgeon. And then we have our PA, surgical PA, Sydney, and she's a great part of the team, because the way that we can function with different surgeries and getting everything done the way that we are doing, this is the entire team. It's not just one person, and we do appreciate all of our providers and also our team at American Surgery Center. Now, Dr. Irgau, I'm going to ask our followers right now if they have any questions. They can post those, and I'm actually checking whether or not we have questions. While they are doing that, I do encourage our patients to take advantage of our social media sites, and we are doing so much these days. And the main reason we are doing it is, again, making sure that our existing patients are benefiting from this. In fact, like when we have case conferences, I do ask patients in some cases to go to the event, and I know like right now a couple of our patients are watching these, and that's extremely helpful. But also, like what we learn from this is not just the bariatric surgery part of it, but overall the wellness part of how well we eat, what we how we eat, how we mix them. So the I mean, this is like a great setup from our side that we feel like we are able to reach out to our patients in a good way. So we want to make sure that we can actually do more. And again, there will be more. But if there are any questions and any other different topics that you would like us to cover, we would be happy to do that. And now I'll see right now, because usually I get some warning from our people that we have questions. Usually we are trying to put the questions out there related to the topic that we have. But if there's any other questions, I'm looking at, I think we covered almost all. I'm just going to wait for a couple of seconds if we have anyone.
Yeah, just to emphasize what you said about these events, Kemal, clearly the most important and the only setting where individual medical care can be rendered is through the consultation, right? When the patients come, we look at their individual history, and that's where we give specific advice and treatment in that setting. But in this setting also, we are able to really divulge information and education about this very important treatment, bariatric surgery. And I do encourage, patients going through the process to participate, because sometimes issues may come up that they haven't thought about, that they will really understand then, or that may reinforce something that they knew already, or they may have a question that may come up in that setting. So I think these are important, and many patients have told me that they've really benefited from them, Kemal.
Definitely. And, the other thing that I do want to tell our followers that we are going to have, we have a couple different organizations. Obviously, the United Medical is already posting the YouTube videos. It's not just the Facebook, but it's going to be also on YouTube. And I'm hoping that next time we'll be live on YouTube and Facebook at the same time.
Great.
We'll try. So we are brave. So there was Dr. I just see a question. There was a question on the exercise. How quickly they can go back to the exercise, and what they need to pay attention. Our patient needs to pay attention.
Absolutely. So we want them to go back exercising immediately. Okay, that's the right answer. Why? Well, because walking is exercise. Moving is exercise. And as you know, in our surgery center, Kemal, within a couple of hours of the surgery, you can see the nurses walking the patients around, right? Walking is critical, it's very important. So it's not only allowed, but it is really recommended because it enhances recovery and also it minimizes complications. So I tell my patients to walk as much as they can, as early as they can after the surgery. So that's important. Now, in terms of actual exercises that may have restrictions, clearly lifting weights, engaging core abdominal muscles is something that have to wait. And we ask people to wait about 4 weeks until they are ready to do core muscle exercises and weightlifting. And that is something that we emphasize, on our post-operative visits as well.
So the other thing that I was gonna, while we are wrapping up the Chrias YouTube channel, we are sharing these videos from different ones. My personal channel also is publishing these, and all the events actually are available, and they have this specific playlist. So if you are not able to catch us while we are doing this live, you can actually catch up with us later on. I personally do a lot of YouTube. Like I get my news from YouTube, I do the shows on YouTube, but while I'm doing that, I'm already doing other stuff. So I think it's a good habit to kind of have your phone or your iPad available. So you may not need to sit down and just focus on that, but you can listen while you are maybe cooking or you are doing yard work. So I think just to kind of change the way that we have, the habits that we have, so that we can actually get this information and also learn more about it. Now, Dr. Irgau, during the pandemic, I always appreciate our physicians, our providers.
Of course.
But my appreciation level is at the highest level during this pandemic, and this is still a huge problem, as everyone knows. And I do want to thank you and your team and our other providers in United Medical ACO who are working extremely hard. And that's what we have for today. I don't know if you have any last comments, Dr. Irgau?
Yes, thank you. I want to thank you as well for all the great work that you do, Kemal, to educate our community and to keep our community healthy by supporting the physicians and the providers who do all the work. I do want to thank everyone that's out there listening to us as well. We appreciate you taking the time, and I really hope that this has been useful for you.
All right. Well, this Friday at noon, we have an event from United Medical ACO. Dr. Barnett Smith is going to be with us, and we'll be discussing social determinants of the pandemic, and we'll be hopefully seeing you on Friday at noon. Dr. Irgau, thank you so much again, and I'll see you soon. And thank you everyone for watching us. Bye-bye.
Thank you. Bye-bye.